Onychomycosis is the most common disease of the toenail, causing nearly 50% of nail deformities and affecting approximately 15% of adults. Traditionally, culture tests have been used to diagnose onychomycosis. However, a culture-based method is considered antiquated. It can take several weeks to confirm a diagnosis, and it's prone to error as well as other limitations. For proper diagnosis, it's important to identify both the pathology and location layer of the presented abnormality and determine a proper treatment plan. Conditions of psoriasis, bacterial infection, hematoma, and the pigment melanin can mimic the appearance of fungal infections. Left untreated, an infection can spread to other nails, skin, or even to the bloodstream and tissue. Ability Diagnostics offers both histology and molecular PCR testing platforms. Assays for PCR testing have been developed for rapid fungal pathogen detection. PCR is fast, usually reported within 3 days, and it's extremely accurate for pathogen identification. Histology offers good accuracy and also reveals the layers involved where PCR does not. Often, both PCR and histology are ordered together or as a reflex testing protocol. Under this protocol, both the pathogens and the location can be identified and reported. Ability Diagnostics is one of only a few national CLIA labs offering both histology and PCR testing for onychomycosis confirmation. Typically, within 3 to 4 days, the provider will receive an easy-to-read report showing the exact pathogen and any secondary infections. Histology reports will also reference the available treatment methods for each pathogen. Ability Diagnostics histology reports are categorized as red for positive, yellow for cautionary, and green for negative. PCR reports list all pathogens tested as being present or not. The risk of misdiagnosing wound pathogens can have serious or even deadly consequences for patients. Advances in molecular genetics has revealed that chronic wounds are often colonized by pathogens that were previously undetected by standard cultures. Some studies have shown that misdiagnosis rates for wound pathogens may be as high as 30%, with the prevalence of polymicrobial infections being present in up to 45% of cases. Advances in DNA analysis through PCR allow for absolute identification of these microorganisms, providing a quantitative representation of all microorganisms contributing to polymicrobial infections, as well as their associated resistance genes. Consequently, custom-designed intralesional drug treatments are now formulated to meet the specific needs of each wound. When specific targeted antibiotics are used in conjunction with good wound management, patients respond to therapy. Debridement and/or molecular testing are appropriate in the following circumstances: a new patient who presents with a history of wound and/or prior treatment, a chronic wound that enlarges in size or fails to heal, or a significant unexplained change occurs in the patient's clinical condition. The requisition forms provide a comprehensive selection field for practitioners, and such data will be used for meta-analysis, demographic indices, pathogen type involvement, treatment time, and much more data for providers' access. Within the detailed reports, certain resistant bacteria may be found which will not respond to a standardized antibiotic treatment protocol. Ability Diagnostics provides the practice with everything they need to submit a specimen. Supply kits include collection bags, shipping labels, return envelopes, requisition forms, and instructions. Proper biopsy instructional videos are also available, and there's an on-site pathologist available for consultation. To get started, your practice will need to complete and sign the new account registration form and submit it to your practice development manager. Supplies are shipped immediately and will arrive at your practice usually within 1 week. Your practice development manager will train your staff on the sample submission procedure to ensure seamless integration into your clinic.